When counseling patients on treatment options for localized prostate cancer, clinical features tell only part of the story. Genomic testing opens a window into the biologic potential of the tumor, helping physicians and their patients make more informed choices. The Oncotype DX Genomic Prostate Score Assay is an independent predictor of adverse outcomes that can help to guide shared clinical decision-making for treatment in localized prostate cancer patients. The GPS assay is available for both clinically low and high-risk patients with localized prostate cancer. Since the clinical decision-making is different for these two groups, there are separate reports for each. For lower-risk patients, the clinical decision is often between active surveillance versus immediate therapy with curative intent, while in higher-risk patients, the questions are typically centered around treatment intensity. In this video, we are going to focus on the clinical high-risk patient report for the GPS assay. The high-risk GPS report is for prostate cancer patients in the NCCN unfavorable intermediate and high-risk groups. The Oncotype DX GPS report is designed to make it easier for you and your patient to focus on the data most important to the treatment decision at hand. The report adds some exciting new information. The report includes post-radiation data from 2 new validation studies for a total of 5 clinical validation studies with 597 patients treated with either radical prostatectomy or radiation therapy. The report begins with clinical information provided by you. Next, the GPS result is put into context visually in a distribution curve that shows where it falls relative to other patients with the same clinical risk. If the independent GPS result falls to the right of the center of the curve, it means the risk of adverse outcomes is higher than the mean GPS result for other patients with similar clinical features. If the GPS result is to the left of the center of the curve, then the risk is lower. Our data indicate that results up to 40 have a lower risk of disease progression, and results 41 or above have a higher risk. This is indicated by the bar below the curve. The report then breaks down the likelihood of disease progression by providing separate risks of metastasis and prostate cancer death within 10 years. These risk estimates were generated from both radiation therapy and radical prostatectomy data and are applicable regardless of treatment chosen. The high-risk patient report provides insight into tumor biology to help you and your patient determine how aggressive of a treatment approach is appropriate. The Oncotype DX GPS assay is an important tool for shared clinical decision-making for your patients with localized prostate cancer. Clinical and pathologic insights. At the top of the report is the clinical and pathologic information that is provided by the urologist, detailing how the patient initially presented and their submitted risk group. In this example, the patient's clinical and pathologic features classify him as NCCN unfavorable intermediate risk. Genomic insights from the GPS result can help to move the conversation to what that risk really means for him. Genomic insights, the GPS result. The GPS result provides actionable data that predicts tumor aggressiveness to help inform treatment intensity given the risk profile of the tumor. The GPS result informs genomic risk independent from clinical parameters and has been validated in 6 prospective studies involving 1,865 patients with localized prostate cancer. The GPS result distribution curve shows the range of GPS results for your patient's specific clinical risk. This curve is displayed prominently on the first page, helping to put your patient's GPS result in context of other similar clinical risk patients. The GPS result is on a continuous scale from 0 to 100 based on the expression of 17 genes in tumor tissue. You and your patient will be able to see which side of the average they land and how far they are from that average. In this example, we can see that the GPS result for this patient is 50, which is higher than average for patients of this risk group. In this example, we can see that the GPS result for this patient is 25, which is lower than average for the patients of this risk group. Based on the patient's GPS result and their NCCN risk group, their corresponding likelihood of disease progression is front and center on the report, shown on a sliding scale plotted along a continuum of risk. In this report, the GPS result of 25 is below both the cut point of 40 and the mean GPS result for this clinical risk group. This information could be used to help inform a change of therapy. For instance, if the patient chose radiation therapy but wanted to minimize side effects by avoiding adding androgen deprivation therapy, which might otherwise be recommended based on clinical classification alone. Genomics Insight, the relevant endpoint. In the clinical validation studies, all patients received radical prostatectomy or radiation therapy as their primary intervention. The risk estimates provided are based on the GPS result and submitted NCCN risk group. When discussing these numbers with your patient, you may want to refer to the curve on the second page, which gives the confidence intervals around the likelihood of distant metastasis, where insights connect. This is where it all comes together. At the bottom of the first page is a clear clinical interpretation of what your patient's collective information means. This helps summarize how the patient's GPS result and risks of disease progression relate to other similar patients and the GPS cut point. In summary, the GPS high-risk patient report provides insight into tumor biology to help you and your patient determine how aggressive of a treatment approach is appropriate. The GPS result is an independent predictor of aggressiveness of disease. The report provides separate risks of metastasis and prostate cancer death within 10 years.